Okay, so we're going to be performing stroking to the lower limb. Indications for this technique would be pain and muscle spasm. What we're going to be doing is applying a superficial pressure to the limb along the long axis of the body. And what we want to do is kind of give the patient some comfort with our touch, as well as kind of feel out and palpate the tissues. We don't want to remove our hands from the body, and we just want to bring a constant light pressure. Rationales for this would be pain. We're going to be doing the gate control theory. So for this, we're going to be performing a non-nociceptive stimulus, which is our touch to the body, to send a signal along the A beta fibers, which will then block out the slower C fiber and the delta fiber signals, which would be a nociceptive or painful stimulus, right at the spinal cord so that they don't really reach the brain and help lower the pain. For muscle spasm, we're using this superficial pressure to give a touch to the muscles and just kind of help them relax, helping relieve tension and reduce the spasm that the muscle's feeling.
Sorry.
You're fine. So the next technique that we'll be performing is effleurage to the anterior aspect of the lower limb. So for this technique, indications would be chronic edema or chronic pain. And for the technique, we're using the palmar surface of our hands in order to apply a pretty significant pressure. We are always going to be doing a centripetal motion going towards the heart or the proximal body. And we're again moving at about 7 seconds or 7 inches per second. So the reason we're going and taking a slight pause is this technique is trying to decrease edema through returning fluids to the lymphatic system. So right here we are trying to almost create a squeegee-like effect that we're moving the fluids to the main lymphatic bed in the knee or the popliteal bed. And by taking that pause, we're allowing those fluids to kind of settle there as well as allowing the vessels to close so we don't get any backflow. For the aspect of chronic pain, again, it would be the gate control theory. So we're applying a non-nociceptive stimulus to the body in order to create a faster signal to the spinal cord and brain to block off the nociceptive C fibers and A delta fibers that are sending that painful nociceptive stimulus. Alright, so for my last technique, it's going to be thumb pad kneading to the upper trapezius. So indications for this technique are going to be adhesions or contractures to the underlying tissues. And the technique has the hands and the patient's skin moving together on the deeper structures where pressure is applied using a circular direction while the pressure is only going to be on half the motion and it's released for relaxation of the other half. It's performed slowly due to the deeper pressure that we're putting on the underlying tissues. And it's going to be performed in a slow, pretty much continuously along the entirety of the muscle. Thumb pad kneading is normally used for smaller tissues and structures. So for the rationale for adhesions and contractures, the technique is going to be mobilizing tissues, using pressure to move them in multiple directions in order to stretch and lengthen the muscle. This is going to break up the fibers that have stuck together and promote the increased range of motion and normal function of both ability to contract and lengthen the muscle. Alright, that's my technique.